Welcome to Center Health, where smarter health decisions begin. Not every medical test saves lives. In fact, some can quietly push seniors toward unnecessary treatments, stress, and even hospitalizations. Yet most people over 70 never hear about the risks. You go in for a checkup, expecting reassurance. But what if you walk out with fear, pills, or a surgery date you didn't expect? New research shows that 37% of health tests performed on seniors lead to more harm than help. Worse, over 90% of people over 70 don't even realize they're being over-tested. There's one test, and we'll cover it at the end, that now causes as many cancers as drinking alcohol every day. And yet it's offered in clinics across the country, with a smile. Let us know in the comments. Has a medical test ever left you feeling worse than before? We read every reply and share personalized health tips with viewers from all over the world. Let's get into it. It sounds simple enough. A quick scan to check your bones. No needles, no pain, and you're in and out. It's called a bone density scan or DEXA scan, and it's often suggested for anyone over 65, especially women. But here's what they don't always explain. After age 70, the results from this test almost always show lower bone density. That's because bone thinning is a completely normal part of aging. Just like gray hair or wrinkles, it's not necessarily a problem.
But seeing that low score can trigger a chain reaction: fear, diagnosis, and medication. The most common drugs given are bisphosphonates, supposedly to prevent fractures. But the science tells a different story.
A study following over 1,200 older women found that after 5 years on the medication, the risk of a fracture only dropped by 0.3%. That's almost nothing. Meanwhile, side effects include jawbone death, yes, really, and inflammation of the esophagus. Let me tell you about Rose. She's a 76-year-old retired piano teacher, active, never had a fall, and walked every day. Her doctor sent her for a scan, and the result?
Osteopenia, a mild bone thinning that's not even considered osteoporosis. Still, she was started on bisphosphonates.
Within 3 months, she had severe reflux and jaw pain. She stopped playing piano. We took her off the meds and instead focused on lifestyle. Vitamin D, weight-bearing exercises, leafy greens, and calcium-rich meals. 1 year later, she's back on stage, with stronger legs, better balance, and 0 fractures. If you're over 70 and not falling or breaking bones, lifestyle changes can do far more than a scary test. In fact, a 2022 study found that exercise and nutrition can reduce fractures by 20%.
Don't let a number on a screen make you a patient when you don't need to be.
But the next test doesn't just change your treatment plan. It can put you in a neurosurgeon's office before you even realize what happened. Memory loss is one of the scariest symptoms for anyone over 70. Misplacing your keys, forgetting a name, it's easy to fear the worst. So naturally, doctors often order a brain MRI. It sounds like the right move, but here's the uncomfortable truth. MRIs show detailed pictures of the brain, but most findings in older adults are meaningless. Slight shrinkage, small white spots, all normal. Yet once they're seen, panic starts. Further scans, invasive tests, even surgeries are sometimes pushed, even when the original symptom was harmless forgetfulness. In one large study, 86% of seniors had some kind of abnormality on their MRI, but only 3% of those findings were actually connected to a treatable disease. That means the vast majority were simply signs of aging, and yet they led to real emotional stress and unnecessary procedures. George, a retired engineer, came in worried about his memory. He was sharp, just a little forgetful. His MRI showed white matter changes. He panicked, stopped driving, avoided friends. His anxiety got worse. But when we tested him properly, his cognitive scores were totally normal. We focused on sleep, hydration, and mental stimulation. In 3 months, he felt like himself again. Unless there are serious symptoms, like seizures, personality changes, or rapid decline, a brain MRI is not the first thing you need. A much better starting point? A simple paper test to check memory and thinking. It's fast, safe, and doesn't turn a small concern into a life-altering fear. Have you or someone you know ever gone through a scary test like this, only to find out it meant nothing? Share your story below. It helps others more than you know. Now let's talk about a test that's so common, it's often done before anyone even asks if it's necessary. And it could be the reason some seniors end up getting heart surgery they never needed. The cardiac stress test. You walk on a treadmill or get medication to mimic exercise while your heart is monitored. It's meant to detect blocked arteries. Sounds helpful, right? But in people over 70, it's often misleading and dangerous. Studies show that up to 40% of seniors get false positives on this test. That means the scan shows a problem where none exists, and that leads to more tests than procedures like angiograms and even stents or bypass surgery, all without clear benefits. Take Raymond. He was 75, walked daily, and felt great. Just mentioned he got a little tired on hills. His doctor ordered a stress test just to be safe. The results were unclear, so they did a heart catheterization. A small narrowing was found and a stent was placed. That night he had a reaction to the contrast dye, damaging his kidneys. 6 days in the hospital. Weeks of recovery. And guess what? The fatigue was from dehydration and skipped meals, not heart disease. A 2017 study found that many seniors who got stents after stress tests didn't live longer or feel better, but they did suffer more complications. So unless you're having chest pain during activity, shortness of breath, or a major energy drop, this test may not help. Better options: a resting EKG or a coronary calcium scan. Both are safer, faster, and far less likely to send you down a path of unnecessary procedures. Still with me? Because the next test is one you've likely had, and it's time we talk about the risks no one brings up. The colonoscopy. Long considered the gold standard for colon cancer screening, but after age 70, and especially after 75, it can be more harm than help. Why? For starters, the preparation is brutal. Strong laxatives that can cause dehydration, dizziness, and kidney issues. The sedation can mess with brain function in older adults. And then there's the procedure itself, which carries a real risk of bleeding, tearing, and dangerous reactions. In a study of over 1.3 million seniors, colonoscopy only saved 2 lives per 1,000, but caused serious complications in over 20. That's a 10-to-1 risk-benefit ratio. Even when polyps are found, many are small, slow-growing, and might never cause harm. Removing them sometimes does more damage than leaving them alone. Let me introduce you to Dana. She was 73, no symptoms, no family history, and 2 prior clean colonoscopies. Her new doctor insisted she do it again. She agreed. A small polyp was removed. That night she collapsed in pain. A bowel perforation sent her to the hospital for 9 days. She lost weight, strength, and confidence. And there was no reason to do the test again in the first place. The U.S. Preventive Services Task Force recommends stopping colonoscopies after 75 in most people. A safer alternative? The FIT test, a non-invasive stool-based screening that can be done at home without prep or sedation. If you're healthy and over 70, talk to your doctor about better options. Because once you're on the colonoscopy train, it can be hard to get off. And now we reach the final and most dangerous checkup on the list, one that's marketed as cutting-edge prevention but may quietly be causing real harm. The full-body CT scan. It's often offered as part of executive health packages or sold as a futuristic way to catch disease before it starts. But the reality? It exposes your body to massive doses of radiation, often equal to 500 chest X-rays, and for seniors, the dangers are real. A 2023 study found that rising CT scan rates may now be responsible for 5% of all cancers in the U.S. That's the same as alcohol. Imagine, 1 out of every 20 cancers, possibly caused by the scan that was supposed to save your life. The problem isn't just radiation. These scans often find harmless nodules or cysts, normal parts of aging. But once they're seen, doctors feel pressured to act. More scans, biopsies, surgeries, panic. Marcus was 80. Still taught martial arts, ate well, felt great. He signed up for a full-body scan at a private clinic. The scan found a tiny nodule in his lung. He was referred to oncology, then sent for a PET scan. Then a biopsy. The nodule was benign, but the biopsy collapsed part of his lung. 2 months of recovery. All for something that could have been left alone. Experts are now clear. Full-body CT scans should not be used for routine screening in people without symptoms. If you have concerning signs, like unexplained weight loss or blood in your cough, targeted scans make sense. But scanning everything just to be safe is like digging holes in your backyard looking for treasure. You're more likely to break a pipe than find gold. Thoughtful. Would you get a full-body scan if you felt perfectly fine? Or would you trust your gut and wait for symptoms first? Let us know below. Your comment might help someone make a better choice. So, here's the truth. Not all health checkups are created equal. After 70, some tests may hurt more than help. And modern medicine, while powerful, isn't perfect. Before agreeing to any test, always ask, what happens next? If this scan finds something, what's the plan? What are the risks of acting versus doing nothing? Because sometimes the most powerful form of prevention is knowing when to say no. Stay active, eat well, sleep deeply, and choose your checkups wisely.
Thanks for watching Center Health. If this video helped you think differently about aging and health, give it a like, subscribe, and share it with someone who needs to hear this. See you next time.